Megan's such a hard worker. I mean, you can always find her at her desk, and she's always pounding away on the keyboard and just always looking for the next thing to take over. And especially with the ACA training, she took that on all herself. There was so much going on at the time, and she basically took it all on herself. And there was just so many barriers in the way with the floods before that, and just trying to get everybody in the whole division scheduled for it was just a job in itself. So I think she really took that on and did a great job with that.
You were nominated for the Any Door is the Right Door Award, specifically to formally recognize you for all of the ACA work that you've done. You trained all of us, and then some, which helped us to be ready. We had a seamless rollout, which was awesome. You made sure we had everything we could possibly have. You redid the training 400 times, maybe. So it's just a thank you for all of that.
Just to give a little bit of background on the work that Megan has done, because I don't think you guys fully recognize the amount of work and effort that Megan put into the training. It wasn't just developing the curricula, the lesson plans, the training itself, but organizing us as managers within the community support division time and time again on the schedules themselves. It took a lot of work and effort, not only at that level, but working with our state stakeholders, with the Department of Health Care Policy and Financing, to make sure that as they were moving along with healthcare reform and the changes, that Megan was on top of all of that and redeveloping the curricula, which it was a lot of work. I mean, countless hours that were outside of the normal work schedule. It just shows the commitment that she has for the work that she does and to our community, because I think we all benefited, but more importantly, our clients and our families will benefit from all of us knowing the ins and outs of healthcare reform. So thank you, Megan, so much. So is that the certificate?
No.
She's developed the curriculum for the healthcare reform for our county, and provided great input at the state level as well in providing the curricula. Sits on the state training team, staff development center. She's a member of that, and she's just been such a great asset to Boulder County. We're so fortunate to have her.
Thank you for bearing with all of the unknowns that we had, unfortunately, in the training. I know you had to get a lot of the I don't know. So thank you for that and for being present and engaged in the training. I really appreciated everything. So, and with everything that's happened, you guys have done great with the rollout for ACA. So thank you so much.
Thank you again, Megan.
So there's cake and snacks and
Job well done.
thanks, Megan.
She's always very supportive and there for us, whatever we need. And you can tell the way she works now, she comes to us, that she cares about what she's doing and about making sure, like with the ACA training, to finding the answers, to getting the right answer, and to really working with people to the point that they understand. In the training, she doesn't just present the training, she's really make sure you're understanding and the class is getting it before she moves on, which I really appreciate, because when people walk away with what they need.
Well, what was challenging about it was we didn't get a lot of the information until probably about 3 weeks prior to the training. I basically had a week between when I got trained and when I had to do training. So in that interim time, so that 1 week period, I was having to update some materials that I had already created to take into account what we had heard. And then some of the business processes associated with healthcare reform were also changing in this time. So some of it wasn't even finalized until the day I trained it. But we wanted to make sure that staff were getting the most current information and the information that they needed to help people. So that was really the goal, was to provide information, but then also not to overwhelm them, because when we were going into healthcare reform, we were under this idea that our entire world was changing, and so really bringing them back to say, it's not all changing. There was like one major change, and having them focus on just that one change, but then realize that nothing else was really changing too much. So that was kind of how we approached it. What I appreciate so much about Boulder is that we do have an emphasis on the community, and we have such strong relationships with the community. And so to me, it is always looking at the customer's view and saying, you know, maybe we can't take care, I can't help with this directly, but what can I do to get you the services that you need? So trying to connect people with that, or serving as that person to be able to help. And just... And even like with training, trying to give people the information. That was one of the things with healthcare reform, was having them have an understanding of what Connect for Health Colorado is, the marketplace, because our people that aren't eligible in our world maybe are going to be eligible on the Connect for Health side, so having them understand how people are going to flow, so they're not just saying, oh, that's not my job, you're not eligible for Medicaid, can't help you. So that was my approach with healthcare reform in general, but then also with how I do everything, even with training and working with our staff every day.